So I'm very pleased to meet you, Samah. So I'm very pleased to welcome our next speaker, who is Dr. Samah Jabr. And she is from Jerusalem, and she is a psychiatrist, psychotherapist, and writer. And since 2016, she's been the head of the mental health unit at the Palestine Ministry of Health. And she also teaches in university. She's assistant clinical professor at George Washington University. And her research is published in both Palestinian and international peer-reviewed journals. She's published columns in newspapers, and her work features in the French documentary Beyond the Front Lines, Tales of Resistance and Resilience in Palestine. And we'll be sharing the link for that film in the chat box. In the last year, Dr. Jabr has been very involved in at the forefront of tackling the mental health impacts of the COVID-19 pandemic in Palestine. So I'm very pleased to welcome you. I did think that you wouldn't be able to join us, but it's absolutely fantastic that you're here with us today. And we look forward to hearing your presentation.
It's a pleasure to be with you, and thank you very much for organizing such an important event at such an important time, especially as the situation is very critical in Palestine, but also on the anniversary of the Nakba. I thank the Bradford Friends of Palestine and the UK-Palestine Mental Health Network for putting this together. Actually, I'm talking to you, I'm dialing from France. I was supposed to take my flight to Tel Aviv today, but because of the situation, the political situation there, my flight was canceled. And I'm talking to you from the place of my friends, and all my friends who live in this place went to a demonstration in Paris. A demonstration that was made illegal by the government. And as I'm talking to you, I'm getting some notifications about the police violence in that demonstration. I'm mentioning this because this is also relevant to my topic, resistance to the occupation as an essential element in the recovery of the occupied mind. I cannot, okay. So let me start by this slide that is very familiar to say 2 points. The predicament of Palestinians can be summarized in this slide as we see the shrinking of the land, the theft of the land, and the fragmentation of the Palestinian society. And when we talk about Palestinians and the mental health of Palestinians, it's very important to bear in mind that we are talking about different groups of Palestinians living in different psychosocial contexts. So here we see the West Bank, where 3 million Palestinians live, and we see a very small, tiny Gaza Strip that's highly dense and that is going through more difficult psychosocial restraints. And we also talk about the Palestinians with Israeli citizenship served by the Israeli medical system, and and hundreds of thousands of Jerusalemite people who are citizens, who are residents of Jerusalem, who are citizens of nowhere in the land. And we need to understand the situation there and the restraints for the Palestinian Jerusalemites, especially because the latest escalation and aggression was sparked first in Jerusalem. I've been with you since the beginning of the day, and I heard the different terminologies referring to the situation in Palestine. Whether we call it military occupation, settler colonialism, or apartheid, We are talking about a situation that creates and sustains and contributes to health and mental health disparities, huge disparities between Israelis and Palestinians, and very difficult conditions for Palestinians, whether directly or indirectly. Directly by causing psychological distress, environmental hazards, and obstructing access to medical providers. Indirectly by retarding economic growth, disrupting social functioning, and hindering efforts to improve healthcare and public health. We have a very challenging situation for mental health professionals in Palestine. It has been claimed that among countries in the Eastern Mediterranean region, the country with the greatest burden of morbidity due to mental illness is Palestine. This was even before COVID and before the current situation and the further aggression. Mental illness is one of the most significant public health challenges in Palestine, according to WHO, due to the context of chronic occupation and the exposure to violence. Palestine suffers from fragmentation of services, of medical services and mental health services. Palestine experiences a significant shortage in mental health personnel. There is also a dominance of a biomedical model that pathologizes individuals easily and confuses between psychological suffering and psychological disorders, and ignores power dynamics and collective aspects of our experience. NGOs exhibit a misunderstanding of the meaning of neutrality and impartiality. I'm the head of the governmental mental health services. In the West Bank, we have 14 community mental health clinics and 1 psychiatric hospital, an ancient hospital that used to serve Syria, Lebanon, Palestine, and Jordan. But since the occupation, of course, it started serving only Palestinians, and now because of the complete closure of Gaza, it serves only the people from the West Bank. In Gaza, we have 6 community mental health centers and a smaller hospital and rehab unit. We also have a wide spectrum of non-governmental organizations that provide mental health services and UNRWA services that provide psychosocial support and MHPSS. We have also private service providers. To give you an idea about the shortage in staff, I compared the numbers that we have in Gaza and the West Bank to other low middle income countries like Lebanon and Jordan. And we see the big deficiency. And of course, we imagine that the psychological needs in Palestine and especially in Gaza are much bigger than in other countries. Before, I don't want to focus on crisis. This is an image to just talk about the providing mental health during COVID time, not during wartime. So when the call was for people to do social distancing and stay at home, we could not think of what social distancing would be like in refugee camps and in highly populated areas like Gaza, like East Jerusalem. So this image is to tell us that the conditions are different from one group to another, and it can be very tough and challenging. This image shows the detention of a child. A child like that can be detained from a demonstration sometimes, from school, or from his home in the middle of the night. The experience has an impact much beyond the impact on the individual. Of course, it's a scary experience, a traumatic experience that can interrupt the development of an adolescent, but it also has different repercussions and cycles of impact on the family and the society. When this happens to a family, the parents feel guilty. The teachers who could not stop the detention of a child from the school, they feel impotent and unable to protect the child. It creates disproportional heroism for that child, and at the same time, more subtle weaknesses in his personality when he comes back. In interrogation, he's told that his comrades, his friends, his classmates gave information about him, which breaks his trust in the society. When the society sees that happening to children and to young people very frequently, the society gets intimidated and unable to express his aspiration for freedom and liberty. This is another image of the impact on individuals and the society. A damage like that, this picture comes from 2014, but this is what's taking place today in Gaza. This huge damage is done deliberately to have a shocking psychological impact, to break the ideology and the system of beliefs for individuals, to damage the core beliefs of people. I listened to David speaking about learned helplessness. Of course, this creates learned helplessness for some people, but learned helplessness is very prevalent in our daily interaction with Israelis, even without having something so shocking like home demolition happening. In our everyday interaction, there is learned helplessness because you need to speak in a certain way, to carry your papers and behave in a certain way, to watch for your body language when you go to Israeli administration or when you want to cross the checkpoint. But learned helplessness is not only imposed on Palestinians. Those in solidarity with Palestinians, even in democratic countries, like here in France, when people go out to demonstrate and they get attacked by the police, it is because the government wants to keep people silent about Palestine. In the United States, when people lose their jobs because they want to be vocal about Palestine, it's another way to impose silence on Palestine. So there are different degrees and levels of learned helplessness and conditioning Palestinians and those who speak on behalf of Palestinians. Rita Jackaman and other colleagues wrote about humiliation, the trauma of humiliation that is so prevalent in Palestine. This image comes from Damascus Gate, the place where the clashes were erupted in Jerusalem. We see this all the time. You cannot walk in the streets of Jerusalem without seeing an image like that, a demasculinizing image that targets young people in Palestine. This is an image that explains the attack on the representations of Palestinians. A pro-Israel media group uses this image to say an image of children carrying one of their comrades, one of their friends, as a martyr. And it uses the image to say that Palestinians, inherently, they have a culture of death and hatred. What do they know about post-traumatic play? Children who have less capacity to talk, they express the trauma in their play. And when martyrdom is part of the daily experience of people, there is no wonder that children express that in their play. Another attack on the representations of Palestinians. This is an image that comes from the Facebook page, the Arabic Facebook page of the Israeli, of the spokesperson of the Israeli army, Avichai Adroi, who uses an image of women participating in the March of Return and writes, women who participate in this march, they lack honor and femininity. I'm facing difficulty. Let me see. I would like to go on in my slides, but something is stopping me.
It might just need a little moment to catch up.
Okay.
There we go.
Okay. So the attack on identity is so vast and colorful, and it can be expressed in concrete papers. This is an old laissez-passer. As a Palestinian, I don't have a passport. I have a travel document that is called laissez-passer, and it refers to me as a person, to my nationality as undefined. And I issued, I was in France and issued a new travel document to allow me to go back home. And it was written in that one that my nationality is Jordanian. Also, the attack on the memory, the deletion of the memory. In 2019, 70 world leaders visited the Holocaust Museum in Jerusalem in respect to the victims of the of Nazism. And little attention was given by media or those leaders who visited Israel to the fact that the Holocaust Museum is built on Khirbat al-Hamama, a Palestinian demolished village. So there is complete deletion and lack of acknowledgement for the Palestinian experience, complete denial of the narrative, and there is hypermnesia for the selective hypermnesia for the Israeli narrative and the Israeli experience. Labeling people with psychiatric disorders. This comes from an emergency room, an Israeli hospital emergency room. A woman goes after the demolition of her home. She develops a panic attack and she goes to the emergency room, a Jerusalemite woman. And there she gets a diagnosis, emotionally unstable personality and malingering. And if she were a man, she would get, if she were a man and she would express anger and shout, and he would get the diagnosis of antisocial psychopathic personality easily. Another form of labeling, when the March of Return took place, there were many foreign colleagues referring to these people who participate in the march, who are expressing their individual and collective agency as people engaged in a peaceful resistance. These were labeled as suicidal. So Israel was shooting people, killing them easily. And instead of challenging the Israeli reaction to the March of Return, there was pathologizing of the Palestinian experience because they exposed themselves to death very easily. And their behavior was labeled as suicidal. This is the Israeli psychiatric hospital, Kfar Shaul. That is where many Palestinian Jerusalemites get hospitalized when they get sick. And it is built on the land of massacred Deir Yassin. So this is just a general idea about the things that we see outside the clinic that challenge the well-being of the community and the Palestinians in general, individuals and the society. And I want to talk about, just to mention a few dilemmas that I face in my practice. The problem with the diagnosis of PTSD, and I've written plenty about that. There is no post phase. Trauma, as we see in Gaza, is repetitive, is enduring, and there is no safe place. So this raises a question about our interventions when we cannot, because most of the Western interventions that are evidence-based and effective in the treatment of PTSD, they are based on establishing a safe place. And I work with many ex-prisoners with whom it's challenging to establish the safe place because they know they can be redetained very easily and at any time. People in Gaza who cannot have enough peaceful time between one attack and another, it's difficult to establish a safe place with them. So I question the suitability of the PTSD diagnosis in the Palestinian experience. How much attention do we give to the local idioms of distress? One of these idioms is العين بصيرة والإيد قصيرة. I'm insightful. This is what some of my patients tell me. I'm insightful, but my arm is short. To explain that they understand where their symptoms come from. They understand their sickness, but they are helpless. They cannot change their situation. So the symptoms will remain. And then how to talk sense to power, whether the political power in our relationship with Israelis or in our relationship with our local power structure or the power of the society, the power of the Palestinian society, the power of the family. So how to help people talk sense to power without paving the way for their suicide, without putting them in a high danger, because we have different layers of power structures that oppress the individual and create symptoms. And without estimating the risk and helping the people to appreciate the risks before them and calculate for the risk, it is difficult to help people to recover from their symptoms. That can be created by the rapport of power, the power relationship. How to get people to talk when there is pervasive mistrust in the community. The person who was told in his interrogation that his friends and his comrades, his classmates, his cousins gave information about him would come to the clinic, but he would worry if I write his true name on my computer. He would worry to give me his date of birth to be identified on the computer, because they asked me, doctor, are you sure that your computer is not invaded, is not spied on? Which is a legitimate question. These questions don't come from people who don't have any psychotic symptoms, from people who are completely sick. Solidarity, another dilemma is solidarity and activism in the face of professional neutrality and impartiality. Often activism is seen as a breach of the neutrality of a mental health professional. And it is challenging to have all these discussions with colleagues to explain that it is a moral obligation. We cannot be neutral about situations of injustice. So beyond the harm to the mental health of individuals, the occupation not only attacks the bodies and brains of those who are individually affected, it also attacks the social fabric, the norms, the symbolic representation, and the collective identity of Palestinian society. Resistance repairs the holes and tears created by such attacks. Some of the collective consequences of the occupation are internalized oppression. Sometimes I get patients who, in their manic phase, who speak Hebrew to me. Prevalent mistrust throughout the community, especially with those who have been spied on previously or whose whose personal experiences explain why they need to be very cautious and not trust others. Low collective self-esteem and self-confidence. When we hear some Palestinians bragging about having access to an Israeli hospital to have better care in an Israeli hospital. Loss of subjectivity, a feeling of being objectified. Loss of agency and acceptance of inefficacy and passive victimhood. Those are just a few examples on the collective level. Like, what can we do in the face of the extreme sense of helplessness, collective helplessness? So in the face of these collective experiences or effects, consequences at the collective level, these psychological consequences at the collective level, the Palestinian resistance can be corrective. Palestinian resistance stems from moral positions and psychological factors more than interests, more than political interests or financial interests. It represents symbolic and spiritual values that are very important for those who are deprived of tangible rights. It has a humanizing influence, acting against the dynamic of objectification at both the individual and the collective level. It is perceived by Palestinians as a legitimate human right and a moral duty. It does not subscribe to the usual calculation of risks and benefits that characterizes business or economic logic. That was also a question raised by David this morning, how many are lost on the Palestinian side, how many are lost on the Israeli side. But I think this is the logic in business. It does not apply to moments of resistance. Anyone who engages in resistance understand that there will be very important sacrifices. It cannot be judged merely by the achievement of end results. The journey of resistance is dignifying by itself, even in the absence of the achievement of desired goals. It maintains a positive conception of an imagined future and renovates hope. But for the Palestinian resistance to continue, international solidarity is very important, and it is therapeutic. When many world leaders, and I would say leaders of significant powers in Europe and in the United States, tell us that Israel has the right to defend itself and talk about the Palestinian aggression and Palestinian terrorism, we feel more isolated. And international solidarity at the popular level can correct this damage that results from the international condemnation of the Palestinian resistance. It validates the humanity of Palestinians. And this is what we do when we take care of a traumatized individual in a therapeutic setting. We do a lot of validation. It acknowledges their feelings and subjectivity. It supports their aspiration to be agents and actors of change. We want international solidarity to not only support Palestinians when they are victims, but when they are agents and actors of change. And it generalizes the mutual and global activism for justice. And like that, it helps Palestinians to get out of their isolation and connect to a wider community. And I want to mention and express my gratitude to professional solidarity within the field of mental health. That was started by the wonderful work of the UK-Palestine Mental Health Network, which was followed by the USA-Palestine Mental Health Network, and after that, the French network and another network in Belgium, in South Africa, and in Ireland. And we have the Palestine Global Mental Health Network, which issued an interesting statement today that shows our position, Palestinian mental health workers, regarding the events that are taking place and calling for international solidarity. I heard Martin mentioning that statement, and this is, you can go to the website. I provided it to Samah, and you can see it's already published in English and Arabic. So please read it and distribute it as much as you can. And thank you very much for listening, and I'm happy to take your questions.
Thank you very much, Samah, for this very powerful presentation. I feel I've learned a huge amount in the space of half an hour. And I think your message about the power of international solidarity will be very comforting for us, because we often feel powerless. And, you know, just knowing that the expression of solidarity is therapeutic and helpful really is empowering for us as well. And knowing that it has its role to play and it's therapeutic. So please feel free to send your questions in the chat box for Samah. So there's a question that's come through already, which is from Harry Fear. Can you please clarify and illuminate the reference to talk sense to power? This notion seems incredibly important and clarifying, and I'd like to hear more.
Often in my practice, I see people that suffer because of the structure of power, because of the power dynamics between them and others, whether the occupation or the local authorities or the patriarchy or the family. And in a place where there is very narrow margins of freedom, it is important for people to understand the risk when they want to express their opposition to power. And this is challenging for me as a practitioner. There is so much mental health, and let us say psychoanalysis is about liberation. It's about the ability of people to make the unconscious conscious and to speak for themselves and express their will and agency. But this can be difficult in a place where the power structure is so damaging and repressive, because it might result in a huge damage and risk for the individual. So when the psychological suffering of my patients is related to the repressive power, I make sure that the person navigates his way and understand the consequences very well, so that they can negotiate their well-being and their needs and their agency with the multiple oppressive powers surrounding them.
Thank you for this. And Harry Fierce says thank you so much as well. So I had a question for you regarding the coronavirus pandemic, because while this was unfolding here in the UK where we are based, there was a lot of mental trauma based on that. And I was just thinking, for the Palestinians, on top of all the traumas that the Palestinians are suffering already, what was the impact of the mental health of Palestinians due to the COVID pandemic?
I think the Palestinians, I already wrote a few things about that. First, that Palestinians were in a double struggle because the occupation did not stop during the pandemic. Home demolition, detention. There was also a plan to annex Area C from the West Bank during that time. So the occupation didn't stop during the pandemic. So we had to deal with that. And on the top of that, we had to take care of the health of people due to the pandemic. There there were, of course, as we understand human rights, we understand that according to Geneva Convention, Israel was responsible for the health of Palestinians and stopping a pandemic among Palestinians because Palestinians are occupied and colonized by Israel. But Israel didn't take that responsibility. And whenever they allowed some donations, international donation or WHO supported kits or vaccines to arrive to Palestinians, they had the opportunity to brag about that and to claim false charity that they were giving to Palestinians. Israel also used the pandemic to make a kind of diplomacy, the vaccine diplomacy, where they were talking about bribing the Honduras and the Czech Republic by sending them some vaccinations so that they will provide solidarity, they will provide political interests for Israelis. Czech Republic at the time was speaking about making its embassy in Jerusalem. So this is what we had to go through. We exposed also in some writings how there was a delay in diffusing the information in Arabic for the community that is served by the Israeli medical system, the Palestinians with Israeli citizenship and the Jerusalemites. There was a delay in establishing the testing stations for Palestinians. So it was a challenging situation. And of course, there was an important impact on the mental health. And in my opinion, it exposed and uncovered the historical, the pre-existing vulnerabilities in the Palestinian health system, especially in regards to mental health. One of the earliest steps that were taken by the Palestinian Ministry of Health, for example, was to close the rehab center for drug addicts, for people with drug abuse problems, which was a very bad decision, in my opinion. It marginalized a group that is already marginalized within the Palestinian community to provide the help to the physical health of people. Again, the mental health of people is unseen, invisible, and easy to ignore.
Thank you for this. We have a question from Martin Kemp. Samah, I think you referred to a misunderstanding of neutrality and impartiality on the part of NGOs within Palestine. Did I hear that correctly, and could you expand?
Yes. I think there is misunderstanding because they think that neutrality and impartiality means that we don't criticize Israel. We don't speak up about the human rights of Palestinians. We just focus our work on the evidence-based interventions without acknowledging the political damage and the human rights violations that are happening to Palestinians, because we cannot be political. So we shouldn't talk about that. And I think that is a misunderstanding of neutrality and impartiality, because human rights are essential part of the health and the well-being of individuals. And by being quiet and silent and intimidated about that, we are allowing human rights, we are allowing the violation of human rights to continue and to generate further damage. And I think all what we can do in our techniques as mental health professionals, all what we can do if we avoid addressing the violation of the human rights is palliative therapy. We are not tackling the real issue that generates the pain and suffering and mental health damage to people. We are just dealing with the consequences.
Thank you for this. So I just wanted to say also that when you said that you were in France, it resonated because I'm half French and my parents are in France, and they were hoping to go to a demonstration this afternoon there in Strasbourg, and I don't know if it's been allowed to go ahead or not. So I'm going to check with them after this conference. There's been a lot of, pro-Palestine solidarity activists in France have been very much harassed by the authorities. I don't think it's as bad in the UK, but it's really bad in France. So it's difficult. So where are you speaking from?
From Paris, and
from Paris, yes.
A few days ago, the head of the AFPS,
yes, Association France-Palestine Solidarité.
Yes.
Yes.
Yes, he was arrested for organizing a demonstration.
Okay.
Right. So yeah, it's tough, and it's an expansion of the efforts to silence Palestinians and those who speak on behalf of Palestinians.
Yes, it's because BDS activists have been arrested as well in the past few years in France. So, okay. Well, thank you so much for your presentation and for answering our questions. So we're now going to take a short break.